Thank you all for joining the third and final session of the virtual workshop, Innovation in Drug R&D for Prevalent Chronic Diseases. I'm Garner, one of the co-chairs for this workshop. Today will be our third session, and we held part one of the workshop 2 weeks ago on February the 22nd on the preclinical and discovery stages of drug R&D for prevalent chronic diseases. Last week, part two, the workshop considered clinical stage drug R&D. And today, in part three, we will discuss case studies and past successes and consider approaches and potential strategies moving forward to spur innovation. I'm very excited about today's session because it kind of represents the culmination of the last 2 weeks of discussions and starts to make application toward ideas and solutions toward solving these problems. All parts of this workshop are convened by a standing body at the National Academies of Sciences, Engineering, and Medicine, the Forum on Drug Discovery, Development, and Translation. The forum offers an ongoing neutral venue for stakeholders from across government, academia, industry, foundations, and consumer and patient groups to discuss and confront issues of mutual interest and concern. Through workshops and other activities, the forum brings together thought leaders to focus public attention on critical areas and foster collaborative activity to understand and address these issues. In accordance with the National Academy's procedures, an independent planning committee organized the workshop. Planning committee membership and bios for the planning committee can be found in your briefing book located on the workshop webpage. I'd like to also thank the forum for their leadership and support, and especially the planning committee for their vision and efforts to plan and conduct this workshop. While this is a standalone workshop and not part of an ongoing consensus study by the National Academies, it is a starting point for future activities related to innovation for prevalent chronic diseases. A summary of the presentations and discussions made during the workshop will be prepared by a rapporteur and will reflect what transpired during the workshop sessions. It will be prepared in accordance with institutional policy and made broadly available to the public. All views presented in the summary will be those of workshop participants and attendees. It will not contain findings or recommendations by the planning committee. The summary will be made broadly available in a couple of weeks following the workshop. For those participating in the Zoom meeting, please remember to keep your cameras turned off and your microphones muted unless the moderator is called on you. If you have a question or comment, please add them to the comment box in Zoom. If you happen to be attending today via the webcast, you also have the option to enter your comments and questions into the Q&A box on the website under the webcast video window. But note that if you're watching the webcast in full screen, the Q&A box will not be apparent. You'll need to come off a full screen to be able to add your comments through the webcast. There are hashtags for this work, hashtag chronic diseases and hashtag drug forum. These will be listed with the branding for the workshop and the rotating presentations. We highly encourage viewers to share their insights and observations about the workshop on social media using hashtags, but note that only comments submitted to the Q&A box during the workshops can be incorporated into the summary of the workshop. Let me now turn to my co-chair, Dr. ANANTHA Shekhar, for further introductory comments and introductions to today's session.
Thanks. Thank you, Carl. It's great to be with all of you. Good morning. And this is our final session of the three-part series. Just want to point out that there will be a 30-minute break at 12 p.m. Eastern time. So that'll be our lunch break between the two sessions today. The workshop will be transcribed, and where the summaries will be available in writing. The transcription will not be made publicly available immediately after the workshop, but staff will use it to aid in writing the workshop proceeding summary. Audience members asking questions or providing comments, please enter your thoughts directly into the Q&A box under the webcast video or in the chat. Speakers and attendees might have a slight lag because of the virtual format, So please give a few seconds before you move on. Video recordings and slides from today's workshop will be posted on the workshop site probably in about a week or so. So it should be available after that. Note that the speakers will be all introduced by their affiliations and titles, but their detailed bios are available at the website as well as in the planning committee briefing book. For the purposes of this workshop, unless stated otherwise, it's assumed that all comments made are the personal views of the speakers and participants and not statements made on behalf of their organizations. The National Academies are committed to the principles of diversity and integrity and civility and respect in all of our activities. So we look to you to be a partner in this commitment by helping us to maintain a professional and cordial discussion environment. All forms of discrimination, harassment, and bullying are prohibited in any of the National Academies activities. So we'll start with the first session of today's workshop. Session 1 is Discovery Research Case Studies, Mobilizing Communities and Resources. The objective of this session is to consider lessons learned from other early stage research from other disease states, and to see if we could use any cross-cutting applications and learnings for research in prevalent chronic diseases. We'll also discuss how research and patient communities have been mobilized to address discovering treatments for some disease states, and those examples will be open for discussion today. We'll also want to brainstorm some potential strategies to spur R&D in chronic diseases based on those learnings.